All right, so we started live streaming. So good evening, everyone. My name is Evelyn Ibolo. I'll be moderating the session today, and this is a question and answer session organized by scholars in Germany. And today we'll be talking about studying and practicing medicine in Germany. So I have with me Dr. Nkem Chukwuka, who is a practicing medical doctor and also a Nigerian and, former NiSIG NRV chapter. So welcome to this session. This is just one of the several sessions that NiSIG National has started since the Ukraine-Russia crisis. And this is just an attempt to answer several questions on different people's mind, with all the unrest and unclear situation. So I say a big welcome to everyone. And hi, Nkem, how you doing? Do you want to say hello to the house? Nkem, you're muted.
Hi, everyone.
Okay, and so thank you for joining us, and thank you for creating time to share, your knowledge and experience with us. So a little bit of our profile, I'd just like to read so that everybody has an idea of who Nkem Chukwuka is. So Nkem Chukwuka is a cardiology resident in Germany, and she completed high school in Nigeria. She migrated to Germany and completed her medical studies at the University of Düsseldorf in 2019. During her studies, she engaged in several voluntary work, amongst which was serving as the president of NiSIG NRV chapter. I thought not Rhine Westphalia. Okay, NRV, didn't land at that. And also she's passionate about helping young people navigate their medical path in Nigeria. So she shares tips and tricks on how to study and practice medicine in Germany across several social media platforms. Outside of medicine, she loves to travel and dance, and also strives to read more fiction. So welcome, Nkem, and thank you for joining us this evening. Yeah, so I can see people joining and the number of participants increasing, but we only have 45 minutes for this session. So if you want to remind your friends to join the meeting, please send them the link, and also send them the Zoom invite link and also the YouTube link. So you can find us as NiSIG EV on YouTube. So this is a question and answer session. So please, if you have questions as regards pertaining the theme, so we're talking about studying and practicing medicine in Germany. So this is quite a specialized session. We're not talking about the legal aspects like we've been doing every Monday. So if you have questions as regards traveling or relocating, asylum, legal questions, this is not the session for that. You can visit the past sessions we've had on YouTube. So if you have any questions pertaining to studying and practicing medicine, please use we should have a Q&A, use the chat session to drop your questions. I'll be taking the questions from the chat session and read it out for Nkem. But as the meeting progresses, if we see that we can take questions, like you can unmute yourself and ask questions, I would give that directives just for orderliness. But for now, please use the chat session. So welcome again, everyone, to this Q&A session. So I would like to invite Nkem to just share a background about how she joined and how she became a practicing medical practitioner in Germany. So over to you, Nkem.
Thank you, Evelyn. Sorry, for those of you, some of you who know me, my name is Nkem Chukwuka. I am, like she said, a cardiology resident here in Germany. I actually went through high school in Lagos, Nigeria, and moved to Germany in 2011. So the first thing I did was basically to learn German up to a level of, I think, B1 then. And then after that, I went through a 1-year accreditation program called Studienkolleg. Studienkolleg is basically like to fill in a gap of, like, let's say in Nigeria, you have a 12-year high school system. That means you go through JS1 to JS3 and then SS1 to SS3 for 3 years, for 6 years insgesamt, and then you go through primary school for 6 years. So you have a 12-year of high school education until you have your school leaving certificate. But in Germany, they have a 13-year school system. So you don't have 1 year, you have 1 year short. If you were to compare your Nigerian certificate to the German certificate. So that's why that 1 year that is missing, you have to make up for it before you can apply to universities here in Germany to study at a higher university, at a higher institution. So that 1 year is called a Studienkolleg. In that 1 year, you learn, if you're going for medicine, you learn like physics, chemistry, biology, and German. If you're going for other technical courses, you can learn other technical courses, other technical subjects. So basically, you're making up for that 1 year that you did not go through in Nigeria. That's what you're making up for it by going through Studienkolleg in Germany. If you already have a 1 year post high school education, let's say if you've gone through I don't know, pre-degree course, any sort of 1 year after high school, you do not have to go through Studienkolleg. So basically that's what I had to do after learning German. So I did German for about a year and then Studienkolleg for a year. And then I started to study at the University of Düsseldorf for 6 years, after which I applied to my cardiology residency, and I'm in my 3rd year of cardiology residency now. So that's basically my career progress in a nutshell. I do not know where people, where people would be, like what your questions would probably be if majority of the people who are joining are from Nigeria, or if it's focused more on Nigerian students in Ukraine who are now in Germany, or who are looking for a pathway to their medical career in Germany, or where the bulk of the people are coming from. But I'm just going to explain the process from you coming from Nigeria with a Nigerian high school certificate, and then you as a foreign doctor who wants to also work in Germany. So those two pathways is what I'm going to just kind of break down, and then we'll discuss if you have more questions. Okay.
Yes, great. So thank you for that brief yet detailed information about your background. And so we're still waiting for the questions. So guys, welcome to this Q&A session about studying and practicing medicine in Germany. So if you have questions, please post your questions in the chat session. Right, so while we wait for questions, I'm just curious to ask, because you described like two pathways. You came right after high school and then you started like College of Medicine. Would that be like medical school in Germany? So would you know if I think most people, I don't know, I don't want to assume, but it's just like, okay, maybe what if someone has done their bachelor's now, MBBS in Nigeria? Do you know how that pathway is for those category of people?
Exactly. Like I said, we have the graduates, the high school graduates who are coming to learn, who are coming to study medicine in Germany for the first time, and then you have the graduates from, let's say, a non-EU country like Germany, or like Nigeria, or like the Ukraine. So for the MBBS graduates from a different country coming to Germany, there are two pathways. First of all, you have to identify if you're coming from an EU country or if you're coming from a non-EU country. For the purpose of this discussion, I would probably stick to the non-EU country because you're coming from either Nigeria or, let's say, Ukraine. If you're coming from a non-EU country, because of this EU system, your certificate is not recognized in Germany. And so you would have to go through some certification processes. The first thing you'd probably have to do is to learn German, like I said, up to a level where you can have a good command of the language, both in the medical terminologies as also in the everyday language. So you'd probably learn up to a level of B1, B2, C1, where you have a very good command. It takes about 7 to 12 months, like approximately. And after that, the next thing you would probably do is to write an FSP exam. FSP is called Fachsprachenprüfung. It's an exam where they basically test your command of the German language. Like, it's made up of 3 different parts. You talk to a patient, like a patient, someone that's playing a patient, and then you relay what the patient has said to you to another consultant. So basically in this exam, they're just testing your German language. They do not care if you get the diagnosis right or wrong. It's just about, do you understand what your patient is telling you, and can you relay this information in good German to somebody else? So basically that's the FSP exam. When you pass that exam, you get a temporary license. This temporary license gives you the possibility to work in Germany as a doctor for 2 years. Within those 2 years, you are expected to now write the medical licensing exam. The medical licensing exam is called KP, that's Kenntnisprüfung. And that's where they begin to test your knowledge of medicine in German, basically. So they're asking you questions about pharmacology and chemistry and all the stuff. So that's the exam. After you've passed that, then you get the permanent German license. So these are just steps that, like, I'm just saying them, but of course they're going to take you some time. So you plan like 1 to 2 years to be able to write all of this exam and then get a German license, which would allow you to work anywhere in Germany as a doctor, depending on the agency, of course, that you choose.
Yeah, great. So thank you for that. So just a reminder to everyone to please drop your questions in the chat session. This meeting is going to end 18:45. And so basically we have just 33 minutes. So if you are waiting for last minute to ask your questions, that last minute might not happen. So please ask your questions now. So we have one question from Kayode, and Kayode says, his question is, can medicine only be studied in German, and is it tuition free to study medicine in German?
No, medicine can be studied in German and English. The problem is it is only tuition free for the German courses, for the German programs, because the German programs are state funded. It's usually a state university where you have a medical faculty, and then you can study medicine there. When you study medicine at this state institution, it is taught in German from the beginning to the end, and it is tuition free. You just have to pay for this administrative fees, about 300 to 1,000 euros per semester, depending on what state you're in. But you also have a couple of private schools. You have, I think, 2 or 3, I'm not sure, just a handpick of private schools that offer medicine in English. The problem is they offer medicine in English, but you still have to have a basic command of German language, because the first two years of German or of medical school will be taught in German language. So you still have to have a little command of German language. And then after that, the clinical years are then taught in English. The problem with these schools, however, is that they are private, so they cost money. So I think I know 2. One is in Kassel and one is in, let me not lie, Berlin. I'm not sure, but they cost about 8,000 to 10,000 a semester. So, or a year, sorry. So it depends on your pockets and your willingness to learn German. So if you say you don't want to learn German at all, you don't want to speak the language, it's going to be difficult. Private schools exist. They are not tuition free. Tuition free is state school, 6 years. And the private schools, I think there is one of them, I think Kassel is 5 years instead of the normal 6 years of medicine. So that's also positive with the private schools.
Yeah, thank you for that. And I think generally it's just advisable to learn German, because that's the best way to navigate the system here. So we have this question from Ada, and she says that I'm coming to Germany this year. My husband, okay, let me just read the other way. She's coming to Germany this year, and her husband has a resident permit. And so she wants to know what are the requirements for her. She already has a BS in economics in Nigeria. So how does she go about this from scratch as a novice? So she has BS in economics. I don't know if Ada saying, are you saying that you want to do medicine from bachelor's in economics? Let's just assume that's what she wants to do, because this is medicine session. Ada, please clarify if this is what you mean. Yeah. So
if this is what Ada wants to study medicine, having a BSc in economics, it means that because she has already gone through a university, she already has a university degree from somewhere, she doesn't have to go through this 1 year of student college like we discussed at the beginning. So all she has to do is, after she arrives to Germany, she just has to learn the language till she has a good command of it. It's going to take about a year, and then she's going to apply to medical schools. So since she's already coming, probably, I think with her husband's, I think she doesn't need a student visa, I'm going to assume, because she's coming with a family visa, I think. I don't know, but let's assume she doesn't need a student visa. Then all she has to do is then apply to study medicine to different faculties, and then it shouldn't be a problem. So the only step she has to go through is learning German. I have not sure. She's going to have to send her, what is it called? Her certifications, her WIEC and everything she has to a particular body, UniAssist, because economics is not science related. So I don't know if they're going to count all of her WIEC subjects. Like she probably doesn't have biology and stuff like that. So she's probably going to have to recertify her WIEC just to be sure that she can actually apply for medicine with her WIEC. So she has to apply to UniAssist, and UniAssist has to recertify her papers for her just to be sure that she can apply straight to medicine from economics.
Yeah, thank you. So the questions are rolling in, so I try to be really fast. So Ada already clarified she's coming for medicine, so I think that already answers our question.
Sorry.
Yeah. So the next question is from Oluwatobi, and it says that, so is the process the same for those that already have MBBS who wants to do pathology? So is it like residency in pathology, or?
If you mean a residency in pathology, then it's the same thing. All you have to do is, if you have your MBBS from, let's say, Nigeria or from the Ukraine, wherever you have it from, all you have to do is, because pathology it's like a residency program under medicine, it's the same process. You have to do, but because you do not, doc, it's the same thing.
Yeah. So for the purpose of time, K40 just asked now that it wasn't clear on the steps to get the permanent license, because I kind of took notes. There's the first one you do if you've not done bachelor's in Nigeria. So I think if your question has been answered, I'll just so that I can get more answers, I will probably just refer you to watch the YouTube session so we can get most people's questions right. But K40 would allow this so that Nkem can go over this again. So his question is, so it wasn't really clear on the steps to get permanent license. And during this period of relocation, where do you stay? And would there be any room for a temporary employment? And how much is the estimate for this exam? I think there's a lot of unknowns in this question, So maybe K40 will just let you ask your questions like verbally so that we can do this. So K40, are you here? Do you want to clarify what your question is? Is K40 here? All right, so let's just keep. Okay, all right. So could you just ask your question quickly? I'm just doing this because of time. Just explain yourself. What do you mean?
Good evening.
Good evening.
Hi.
Okay, I'm a final year medical student in Nigeria. So my uncle sent me this link. So I want to really be clarified on like moving to Germany. If you don't have anybody there, how do you cope? Like, okay, which type of visa do you need first of all? And during the time of processing of the visa, maybe you land there in Germany, what would you be doing to get money to like foot the bills and do some other exam? Because she said there's going to be some temporary like testing for the language and every other thing. So during the process of testing for the language, will you just be idle, or will there be something else you can do to fetch yourself some money And I would like to know how much, if, okay, maybe if these exams, like you said, the permanent license, if they really cost any money. But that is more like my concern.
Okay. Thank you for clarifying. So Nkem, please.
Okay. So you said, first of all, how do you come here? Most people,
Yes.
yeah, the first thing, because you're not coming as a student, you're probably going to come looking for work. But because it's difficult to get a residency without having a German license from Nigeria already, what most people do is that they come with a language visa. So when you come, you would apply to a language school here. You'd study, you learn the language to like B1, a C1. For that time, you're covered by your language visa. And because the language visa is usually above 3 months, it is possible without having to, you can change that language, that's work visa, without having to go back to Nigeria. You understand? Okay. So what you do is you apply for a language school, you apply to a language school, you get admission, then you apply for a language visa that exceeds 3 months. And then when you come here, you learn your language to whatever point you're good enough. Some people also learn medical German, but that's a story for another day. But you learn to B1, B2, and after that, you write your exams. During this time, some people can pick up work. I have to warn that the language visa sometimes does not allow you to work, just to be safe. Like some language visas do not allow you to work. I heard of some people who have a visa over 3 months and then they're allowed to work. But some people get just a 3-month language visa from Nigeria, which they have to extend here. And then sometimes they have problem with working. Okay. But if your language visa covers you to work, I can make some research. I'm not sure, but I know of some people who came with a language visa and then extended it and could work. If it covers you to work, then you can work as anything. You can work as a nurse's assistant, you can work as a phlebotomist, you can look for small jobs. You don't have to do like menial jobs or so. Okay. So, that's great. But it doesn't. Yeah, it's also going to be difficult to cover you the whole of the month, let's say, but it should give you something so that you're not basically something to cover your basic needs, let's say.
Okay. So what about the exams?
The cost of the exams, I'm not very sure. Let me not lie. I'm not very sure. The last time I was making research, I think the FSP, the first one you write that gives you the temporary license for 2 years, I think it costs 600 euros. I'm not sure. Like I said, I'm going to make some research. Maybe I can write you later, or maybe you can check it online. I'm not sure. But it's within that range, I think, 600 euros. For the KP, I do not know. I'm sorry.
Okay.
All right, great. But just on this question, like I know in Germany there are always financial aids and all of this. One company is paying for this. So did you have to pay, or is it different for if you're in a state school and there are other financial aids for those that probably have this question?
This scholarships, financial aid for your first degree in Germany is pretty difficult. You have a lot of scholarships for, let's say, a PhD, or you have funding for even your master's. But because your first degree is already free, it's tuition free, all you have to do is pay for your upkeep. There are not many scholarships that cover this, but there are some that like help African students, evangelical. The Protestant church also can give you some kind of aid, just little stuff to keep you in the month, you know? But they're not as much scholarships as you'd hear maybe in the US or in Canada, because it's tuition free. So what are they giving you money for if it's not just your upkeep, which is something that also you could probably work and cover. Of course, it's not that easy, but it is doable.
Yeah. All right, so we'll move to the next question. We have so many questions, so if we can just wrap it up. So we have Priska said, is it possible to do internship here in Germany if I learn the language and I'm a medical graduate from Ukraine?
Yes, you can. I have I've actually I have a friend who had actually applied for an internship. Also, she had to learn German. That's a different story, but in fact, you can. Let's keep it short. You can. You learn
So
German.
how can someone get this? Would it be like search online, or is there a
Yes,
particular?
you just write to the universities. The teaching hospitals are very great at accepting interns or hospitations. The problem is most of them are not paid, especially because you do not have a license, so you cannot practice. So according to them, you're not doing anything actively to help them. You're just learning. So it's not usually paid. But they are grateful for the extra hand. Maybe if you can take some little jobs off their hands, they're happy. So it shouldn't be a problem. I have I have friends who have done internships without even having finished their MBBS degrees. That's not a problem at all.
All right, great. So there's this question from Coyote, and it's basically asking, do you need to take any exams in German before gaining admission to a public school? We don't want to spend too much time on that. But he said, can you explain the process of getting accepted? I would just assume that it's the same process of getting admission. You check the particular schools, check their requirements. Some courses are in English, some are in German. Just it's different for every school. So there's no one answer fit all for this question. So, Nkem, you agree, right?
I agree.
Or you can add something. I'm just trying to move
Because
to the big questions.
like we said, just to chip in, there are certain things that you can do to boost your application. So it's not just you apply, you can do like, there is this compulsory nursing internship you have to do during medical school. It takes 90 days. Some people do this before medical school just to boost their application. Some people also take some exams. There is a test that you can take. It also boosts your medical school application. So it's not just like the way you just apply for every other course. There are some things that you can actually do to boost your application. But yes, and apart from that, the rest of the stuff is pretty much basic.
So where can someone get like access to this? Because you actually say some German names that someone from Nigeria is just like, what is she saying? Is there like can you maybe later drop a link, or can you just direct them to like a particular website where they can see all of this?
Video about that. I'm on YouTube and Instagram where I share some stuff like that. So I can actually make a about this, and then I'll just give you guys the handle of my maybe YouTube video.
So you can drop a link to your YouTube video so they can check. Yeah, I think it will really help, right? Because German names is very difficult to keep to your head. All right, so the next question is from Samuel Okoro. It said that it wants to clarify. So for a fresh medical graduate from Nigeria with MBBS, the first step is to write the FSB German language exam to get a B1 certificate. And how much? So is that right? That's
the other way around. You learn German to get a B1 certificate, and then you write the FSB exam.
I think you should say that again, because you mentioned there's the FSB, which is just a test of your language, and there's the next one, KSP, which is test of your medical knowledge.
Correct. Okay, let me break it down again.
Let's do it again, yeah.
First things first, you have to learn German. Without German, nothing. So German up to a level of minimum of B1, preferably B2 to C1. When you learn German, you now go and say, okay, now I've learned German, I want to get a license. They tell you, no, you first get a temporary license. A temporary license, to get that, you have to write an exam called FSP. FSP is just a test of your German skills. Can you understand what your patient is saying? Can you take a proper German, a history in German? Can you relate to your consultant what your patient has told you? Just talking in German. Doesn't matter if you get diagnosis right, all those ones don't count. Once you pass that, then you get a temporary license. Temporary license allows you to work for 2 years in German, in a German hospital as a normal doctor. You earn the same pay as a German doctor. And then within that 2 years time frame, you have to write a KP. KP is Kenntnisprüfung, and KP is basically the test of your medical knowledge. So they're testing you on surgery, internal medicine, those kind of stuff. And then after that, when you pass it, you get your license, your permanent license. And with that, you can start your residency immediately.
Great. Right. So a couple of people are asking for your contacts. And so first of all, for everyone, information for everyone, Dr. Nkem's YouTube link or vlog is already in the chat box. You can scroll up to 6:19 p.m. You'll find it there from a NiSIG EV. And then also someone also asked then, can we have your contact email address in case of future questions? Is that an information you want to share, or is there like that's a question for you?
I do have I do have an email address that I have linked to my Instagram page, but it is basically, let's make sure my English club is doc.nkem@gmail.com.
So DOC.
Yeah.
Okay, so doc.nkem@gmail.com. All right, great. So the next question here is, what if I want to go into academics with MBBS from Nigeria? Will I still have to go through the process you explained earlier, or I can go ahead to start MSc?
Yeah, and that is actually a second pathway. That is the second pathway with which students also, or people also come from Nigeria to Germany. You can come using an MSc visa. You can come to complete an MSc program. So from Nigeria, you apply for an MSc. That one you can get scholarships for them. You can apply to public health. Some are in English actually, and some of them are in German, depending on what course you want to study. And then when you come here, you do your MSc and then you remain in academics. You don't need to go through all of that. But then you cannot practice medicine in Germany if you only do the MSc process. But some people I know use this MSc to buy time by completing this master's program and learning German by the side. So at the end of, let's say, 2 years, they have an MSc and they have learned German to a very good level, and then they write their FSP before their KP. So this is also a process that you can take. There are actually 3 pathways to come to Germany. Let's say you're a foreign trained medical doctor. You can come directly, learn the language, and then do that. Or you can come with an MSc, and then during your MSc, you learn German, you do all of that stuff, the exams, and then you will start working. Or there is this possibility, but it is like basically for someone from Nigeria, 70 to 30% chance that it will work. You can submit your papers for certifications and accreditation, and argue that your Nigerian medical license is equal to the German medical license. You need to get a lawyer to do the process, and most times it is not fruitful. So like there are 3 different ways you can come. You can either come with the MSc, like I said, come straight, or you do this accreditation process. This accreditation process does not work well. Okay.
Right. So I hope, I just want to, I was about to say, I hope people are taking notes, but then again, we're in the digital age. You can always find this video or live stream on NiSIG EV YouTube page. So please watch so you get it right. So Samuel Okoro asked the second question, and so I'll just summarize. So because you've already answered the part, he's asking, would there be payment? Is he entitled to payment of salary during these 2 years working license? Yes, right? Great. Yeah. So the second part is, can he bring his family members from Nigeria to join him within those 2 years of working?
Ooh, that's a visa question. I'm not very sure about that. Like, I wouldn't want to say something I'm not sure about, but
like legal.
Yes, it's illegal. I really do not know.
Yeah,
that's out.
Yes, but I think maybe just to give like a street advice, right? Just what kind of visa, check your visa that you get. What paragraph is it? You can also make inquiries yourself online, or get a lawyer and ask, this is my paragraph, what can I bring my family and all of that. So, but we are not lawyers here. Dr. Nkem does not have diagnosis to this question. All right, so we'll move on to the questions. We have so many questions. So if I see a question I feel like has been answered, we'll probably just skip it so we can attend to more questions. Yeah. So this person said, okay, sent a direct message. So let me skip the name. So the question is, after studying medicine in Germany and you want to return to Nigeria, would it affect your clinical practice since you studied in Germany?
Sorry, what?
I think the person is saying that, so if you, these are questions that it's like so many assumptions. So she's asking, my question is, after studying medicine in Germany, I would assume maybe if the person left Nigeria without doing MBBS in Nigeria, right, and did it in Germany. So if she wants to, he or she wants to return to Nigeria, would it affect their clinical practice since they studied in Germany?
What do you mean by a clinical practice? I don't understand. Do you mean by
Maybe would they be able to practice in Nigeria?
Oh, I think you actually have to write an exam to practice in Nigeria. I think Nigeria does not accept any, I'm not sure, but Nigeria is very strict on what they accept. I know that a couple of people have to write, I think Germany is amongst, I'm not sure, but you have to write some exams in Nigeria to be able to practice, I think. I'm not sure, I've not made that inquiry.
Please, can I clarify what I meant?
All right, great.
Okay, I meant if you cease studying in German language, right, not in English, and you're coming back to Nigeria, which is English, would it affect, practicing since you're basically just in German?
Of course, absolutely. Because even me, like sometimes there are patients that even speak just English, and then they're like, "Who speaks English?" Nkem speaks English. No, I don't know nothing. I don't even know how to explain those stuffs in English. I have a hard time reading English textbooks. I have a hard time watching, let's say, English YouTube videos in medical field. And I think that's why a lot of hospitals want people to learn, like foreigners to learn German and also learn medical German. There is something called medical German. I think they teach you for about 3 months, because there you learn the terminologies of medical language, of German language. You learn the medical terminologies in German language, because you get very confused with the little stuffs. Like, let's say oxygen. You do not know oxygen is Sauerstoff. If you go to just the normal German school, they do not teach you this per se. So if you go to the medical German, then you learn this kind of fact jargon, like this terminologies that you use in the medical field. So if I were to relocate to Nigeria right now, I think I would have a very hard time. I've also done some practicals, internships also in Nigeria. I did a 2 months internship in Nigeria, and for the first few months, you would know the big terms, you would understand some things, but some things would not come to you as easily as it would if you had studied in English. So it will affect you, I think, for the first few months, but after that, I think you should be fine.
Okay, thank you.
Okay, thank God you answered that question, because if I was going to give an answer, I was going to say that, well, it's Nigeria, as you're foreign trained, you should be like a hot catch, but I guess I'm wrong. All right, thank you for clarifying. And so there's a question from Ayo John. I didn't want to skip it because I won't be rude, but let me just, it's up to you to answer. And he says, how much is the doctor's salary in Germany? And the tax rate, I heard, is 40%. It's a matter of cash.
It is. I am open to answer. It's not a problem. The tax, there is a basic salary during residency, and this is paid irrespective of your field of work. So, irrespective of your field of work, you're paid the same basics of salary. The only thing that differs is the amount of the amount of 24-hour calls that you do. So let's say you're just the first month of working, you don't have any calls, you're not, you're just coming to work in the morning and you're going in the evening. You get about 4,000 something. That's brutto. That's before tax. And then after, and then depending on your tax number.
Your tax column or bracket. I think it's brackets.
Now, brackets, depending on your tax bracket, it can be up to 42%. If you're single, like if you're not married, single, no kids, you can pay up to 42%. I think I pay up to 40-something%. So if you minus that, then you'll be left with something like maybe 2,000 something. But that's for the first few months before you start doing on call, like before you start going on call. When you start going on calls, you can have double of, have even more. It just depends on how much 24 hours calls you take. You can double your salary with that. And yes, like you said, tax brackets 40-something%. Yeah, I am 40-something%. But some people are as low as 20-something, I think 30-something. It depends on what bracket you fall into.
And yeah, I was thinking you guys are living large.
Yeah, not.
It is well.
Residency is not fun. Okay, where that money
well.
time not fun. Exactly.
Right.
When you go after your residency, when you go further, when you become a consultant, then you get paid well. But before then, it's just peanuts and biscuits.
Right. So there's some questions like we need to. Oh, okay. Let's go to the end. All right. So we have a question here from David, and it says, "How easy or possible is it to write the USMLE after or while studying here in Germany?" I don't know. Do you understand the question?
Yeah, the USMLE is the American accreditation system. It is possible. People do it. I actually intended doing it one time and then no, I didn't do it. But I feel like it is possible. The only problem you're going to have is switching to learning in English again. Like I said, I have difficulty speaking up an anatomy book in English and reading it and understanding and concentrating. I just think if you want it, if it's something that you want, it's something that you can get. It's not that difficult. Medicine is the same everywhere. It's just the language that differs. So I think it's not that difficult. USMLE is difficult, but it's not that impossible, Sajman.
Great. Thank you so much, Dr. Nkem. So we've been in this session for the past 40 minutes and our able General Secretary has been dropping summaries for us to catch up. And so just a reminder for everyone that this meeting is live streamed on YouTube. And also a summary, just like likely ways to get into medical field in Germany. Nkem has said we have like 3 ways. So you can come directly through German language learning programs, or you can come through an MSc program, or you can come through accreditation of your existing paper. That one you have to get a lawyer, right? So moving on to the next question, it said from Samuel Okoro, another question. It said, please, I want to ask, must the German language be learned in a school in Germany, or you can start learning from Nigeria and then enroll for your German language exam on arrival in Germany?
So you can start learning in Nigeria already. There is the Goethe Institute. I think there are some other private German classes that you can already start learning from in German in Nigeria, and then you come and continue here. But I would definitely advise, unless you have so much time on your hands, to definitely learn in Germany, if possible, because there is always this effect of learning a language and making use of the language in your daily life. It means that you're learning the language, you come home, you put on your TV and you're here in German, like you have the language, what do they call this thing? By assimilation, something. But in fact, it is usually better to learn a language in a country where the language is spoken. But if you have time, you can already start in Nigeria and then you come here and you continue.
Perfect. Thank you so much. We are so on time. We just have 2 minutes to the end of this session, and I'm glad that we've been able to take everybody's questions. So I was going to say that we'll just take one last question. So there's already a question from someone, a direct message. So if we have does anybody have any question that's probably not been attended? So people are shy and they're just probably waiting for every other person to ask the question and get their answers. So if there's anyone, this would be the time to ask your question. About to
speak now, forever.
Exactly. Speak now, or maybe not forever. You can wait till next week because we have sessions every week. All right. So, does anybody have any question? Please just unmute and go for it, or raise your hand or something. Counting down 5, 4, 3, 2, 1. No question. Right. So I'll take this last question from the direct message I got. So she said, assuming your WAEC was 8 years ago, you have biology, chemistry, physics. Though is somebody wants to ask a question? No. All right. So this is like a follow-up question from Ada. I'm trying to see what the question is. Yeah. Let me just read it as it is to save time. Second question, please. Assuming your WAEC was 8 years ago, you have biology, chemistry, physics, etc. Though you have a degree in economics, will the WAEC still be handy? And what are the exams you take to boost your chances of getting admission in medicine in Germany? And is there something like screening exam there?
When you're applying, it's just like applying to whatever you're applying for that has to do with school, they'll still ask for all of your or whatever results you have, your high school leaving certificate, MSc, everything. They'll probably still ask for it. And the fact that your BSc, the fact that you have a BSc will probably boost your application. It just shows that, okay, you've been in school, you've learned so and so and so. So it's basically like an extra point for you. So your WAEC would still count. I don't know if you're talking about like your grade in your WAEC, it will still count because that's what you're going to still use to apply to university. It's just like applying to something in Nigeria. If you're applying to a university in Nigeria, your WAEC will still count. Even if you're applying to a second master's or a second bachelor or whatever, your high school leaving certificate still counts for what it is. That being said, the second question was...
Is there a screening exam?
Screening exam is no, there is no screening exam except if you go through the student colleague process, then your student colleague exam is then your is the grade with which you then apply. There is no screening exam per se. There's only an admission exam into the student colleague, but there is no screening exam for medicine.
Okay. Right. So we've come to we have someone that's there direct DE. I think DE is direct entry. I'm not sure what this abbreviation. Is there direct entry possibility into medicine? So direct entry is like if you skip first year of school and go to second year. I don't know if that's what the person's saying.
I do not think that is possible. I think you can transfer within medical faculties in Germany, but I do not think that you can study biology and then transfer to medicine.
All right. So thank you so much, Dr. Nkem. Last question, what's your Instagram handle? Some of us would like to follow you.
Dr. Nkem.
What?
Dr. Nkem.
Dr. Nkem, so that's DRNKEM.
No, DOC, doctor, full.
Full, Dr. DOCTOR. Okay, yeah, perfect. So Dr. Nkem, so thank you so much for your time. Thank you for sharing your wealth of experience and knowledge. Would you have any final words? Yeah.
Sure. Thank you guys for having me. It was really fun to discuss. And if you have any other questions, definitely hit me up. I am open to discuss more of this, especially if you have friends that are coming from that are coming from Ukraine, that are right now maybe displaced, do not know how to go further. Definitely hit me up. If I have any information, I'm going to be happy to share with you guys. And I wish you good luck in all of your endeavors.
Yeah. Thank you so much. It's been a pleasure having you. And to everyone that joined this session, please, it's been a pleasure having you all. Please share the live stream link with your friends, share this information with everyone that might need it. And a big thank you to NiSIG for planning and organizing this event. So bye.